I'm Tonya McGrath, executive producer and host of the PowerPLAY show. This week, our guest has made it his life's work to be on the front lines of social justice, equality, and change. From being a patient to helping patients across the state, Michael Curry, president and CEO of the Massachusetts League of Community Health Centers, is working around the clock to help communities gain access and information to COVID testing centers and vaccinations. We discuss his work, his hope, and fight for equal quality health care for all. That's next on the PowerPLAY.
From the studios at Hull Bay Productions, this is the PowerPLAY.
Welcome to the PowerPLAY. I'm Tonya McGrath. All this month, the PowerPLAY is celebrating Black excellence by bringing you the people and stories of those who work in dedicated areas to bring and uplift people and their lives, particularly in communities of color. Our guest today has made it his life's work to be on the front lines of social justice, equality, and change. Michael Curry has recently taken on leading the Massachusetts League of Community Health Centers, where he plans, among many other things, to manage the fears and inequities of communities of color when it comes to the access and dissemination of the COVID-19 vaccine. Formerly, Mr. Curry worked as the Senior Policy Analyst at Blue Cross Blue Shield, where he counseled on legislative and regulatory matters in the state. He also served as president of the Boston branch of the NAACP, where Mr. Curry worked on revitalizing the chapter and recruiting new members. Michael Curry has made it his career to advancing the lives of African American people, not just in Massachusetts, but throughout the country. And I am thrilled to have him join me as today's guest. Michael Curry, welcome to the PowerPLAY.
Thank you. Thank you for having me, Tanya.
I have so much that I want to talk to you about. I know that this is just an incredible time, particularly when we're talking about COVID, the pandemic, and access to testing and vaccines. But just first, give our audience a little bit of you, your background. I know that you are Boston born and raised, but just give us a little bit of your background.
Yeah, I always start with where I'm from. And there's a phrase I sort of live by, which is where I'm from keeps where I am in perspective. I'm a kid who grew up in Roxbury. For anyone who's ever read Elizabeth Wilkerson's book, Warmth of Other Suns, my mother moved up from Alabama without family here, just to do domestic work. Worked in our hotels and ended up working for a pretty wealthy family in Chestnut Hill for most of my lifetime. Actually, yeah, most of my lifetime. And she ended up having me, her second child, here in Boston. Born and raised in the Boston Public Schools, born and raised in church, Ebenezer Baptist Church in the South End, and experienced all of what an African American would have experienced in the 70s and 80s and 90s in the city of Boston. And that comes with the good, bad, and the ugly. I have some great stories to tell, but it also was around health inequities and criminal injustice. It was about housing insecurity and food insecurity. We were a poor family in Lenox Street housing projects for most of my young adult life. And then I had a chance to leave Boston, go to college in Minneapolis, St. Paul, gain some consciousness and some context, I call it, for where I came from, because I didn't get it at home. And once I became a Black activist on campus in Minneapolis, St. Paul, I was inspired to come back and bring that energy and that activism back to the neighborhoods where I grew up.
Were there people in your formative years that were inspiring to you in terms of being civically engaged and really kind of working towards social justice?
Yes, interesting. I think about as a young child, I didn't necessarily connect with the struggle, as we call it. Those of us who now understand this racial reckoning we're in. My mother just did the work, so I grew up with a mom who, despite the fact that we were latchkey kids, on weekends would take our used clothes to other people in the housing project. She would show up when people couldn't feed their families. She was the one at the church on weekends, Tanya, who you remember helping to cook the meals and having us run around the church while she was helping the other church ladies really do the work of feeding and clothing people in the community. So that example mattered more than anything she could have said to me. I watched her service. And I think it was just ingrained in me. I also had Reverend Kirk B. Jones was, to me, to this day, one of the most phenomenal ministers in the city that I remember as a kid listening to him. And it was like listening to Dr. King, his oratory, his passion. Whenever I would hear him speak, I would think, you know what, he's as good as Dr. King. And it inspired me to want to be able to deliver that same kind of message. So it's been those two influences, Mom and Reverend Jones, and then many others who came later on. But those early years, those were two of the critical ones. And many of the Black and white teachers who poured into me, both at the Jackson Mann Elementary School, Martin Luther King Middle School, and eventually at Boston Latin Academy.
And as a dad, do you also kind of try and instill that same importance of civic engagement?
Yeah, you know, again, it's by example, right? So sometimes you have to balance between pouring it in orally and then just letting them see you. So my kids, since they were babies, have gone to meetings with me. I remember taking my oldest son, who's now 25, when he was a baby, to the Million Man March Mobilization Committee. So he was born in 95. So Mel King and Sarah Ann Shaw, all these legends in activism in Boston and Greater Boston, many of those Black activists and leaders grew up with me in a meeting with a baby in my arms. So, you know, he's seen it, you know, and it drives them crazy, Tanya, because they've sat through 3-hour meetings with people arguing and disagreeing over strategy and messaging. But I'm assuming and I'm confident that I'll see over time that degree of commitment to community and to quite frankly, to social justice, racial justice is a part of their DNA.
I want to move a little bit into your role when you were president of the Boston chapter of the NAACP. And, you know, I know you now still serve on the national board, but in the Boston chapter, you talked a lot about wanting to kind of revitalize and recruit young people. Was that a difficult task? Because I know that for some younger generations, they kind of look at the NAACP as like the old way of doing civic engagement. How were you able to kind of communicate that to younger generations?
Yeah, it was very difficult. And it was difficult for a lot of reasons. One is, and your viewers may be shocked by this, that NAACP presidents across the country, there's 2,200 units from here to Alaska to Florida to Texas, in every city and town, mostly every city and town, are all volunteer jobs. So, you know, when the phone's ringing, when the emails backed up, when people are calling because their child was arrested or someone was shot by law enforcement and they feel it was unnecessary use of force, or they've been laid off from their jobs, or they're dealing with health inequities, they call us. It is all volunteers that respond to this. So I just want that to sit in with your viewers a second. That in addition to raising 3 boys, having a full-time job, or whatever else, a relationship and everything else that goes on in our lives, and for me, I then had to give a full-time commitment to trying to respond to those things. I want to credit, as we talk about the superheroes responding to COVID-19, those doctors and nurses, those people on the front lines of doing great things, those first responders, we need to also recognize our civil rights first responders, because we never do that. We never acknowledge that when people are doing this, they're doing it for our people, for democracy, for the greater good, and they're doing it with no money. So that being said, it was very difficult for many reasons. One, to your point, the generational divide is a lot of the branches across the country are older guard. When I came into the Boston NAACP, Lenny Alkins was the president. He warmed me, he welcomed me in. He said, Mike, whatever you want to do, I got you. And he let me fail. You know, I call it fumble. He let me fumble. But the reality is there's some old guard within the branch that just didn't want to have a website because they didn't think we needed one. Or they didn't want to reach out and do messaging in a different way to younger crowds. And I had to swim upstream with that. And that's just human nature. People are just resistant to change. And that happened over time, that it took time to sort of crack that. And now, and then the perception, right? We thought we were, when I got elected in 2010, we thought we were post-racial. not all of us thought that, Tanya. There were some people
Yeah.
who foolishly thought because we had Barack Obama, we had Deval Patrick here in 2006, and Barack Obama elected in 2008, that we were post-racial because they didn't know what racism was, right? Only somebody who didn't know what racism was thought we were post-racial, but some people thought that. So you'd have a lot of people say, hey, they're an old organization, they don't know what they do. They didn't realize we were still in the boardrooms, campaigning and championing diversity, that we were still in the courtrooms, challenging discrimination. We were still in communities calling for criminal justice reform, policing reform, and that never makes you old because those issues were still here. And thank God for Black Lives Matter, the movement, not necessarily just the organization, because there is an organization, but the movement is bigger than that. So I had to, as I was president, reconnect the NAACP to other movements, because even during the civil rights movement, the modern civil rights movement in the 60s, there were many organizations. Montgomery Improvement Association, you had SCLC, Southern Christian Leadership Conference, you had SNCC, the Student Nonviolent Coordinating Committee, you had the NAACP, the Urban League. We've never been monolithic in sort of our approach to the struggle. And I had to remind people of that no, we need Black Lives Matter, but we need the NAACP still.
Yeah, that was actually going to be part of my next question. You touched on it a little bit, just the having to kind of come into the 21st century, into this digital space, into this virtual world, and being able to get your messaging across that way, and partnering with the Black Lives Matter movement, because that is more perceived as a younger kind of grassroots civil engagement organization. So did you find that you could make those connections easily?
You know, there's a challenge generationally. You know, I still bump heads with the older folks in the NAACP, right? Because it's just natural, right? Is how to do things, the strategy, the technology. So younger folks will bump heads with me. That's just sort of the way of the world. But what we have to do, and to your point, yes, it was difficult, but I had to win their trust first. Because like me, they came into some of these old anchor organizations, and then they weren't received well, right? They weren't invited back to the meeting. They didn't get the communication, or they were told that's not the way we do things. So there's two battles that I and others have to fight. We have to change that old guard culture that we don't adopt, and we're not nimble enough to accept in younger talent and younger perspectives. And then two, also adjust younger people to say, don't throw the baby out with the bathwater. That the reality is you got to respect and appreciate those freedom fighters who came before you, and then adopt their strategies. Because what'll happen is, and you know this, Tanya, when you're young, you just want to do everything new. But the reality is I can tell you every pothole you're going to run into if you listen. So we're trying to bridge those two, that intergenerational divide that sometimes exists. And I think we're doing that in the NAACP. It led to myself, the NAACP president in DC, the NAACP president, former NAACP president in Dallas, Texas, pitching to the National Association the start of a program we call Next Gen. So we have trained hundreds, and I say that again, hundreds of young 21 to 35-year-olds, now 40, to be leaders in this organization. And we taught them ethics and leadership. So how to not get caught up in all the drama and controversy that people come after us with. We taught them how to deal with the media, how to use them to your advantage, how to make sure that your stories get covered. We taught them the policy issues, police reform, what's in the justice and policing bill, what is a body camera policy, an effective body camera policy. And now we've dispatched them all over the country, and we have hundreds of soldiers in civil rights trained. That all came from that experience, Tanya, of not being received well initially by all of that old guard. But I think we're a train that's moving now.
I want to now turn the conversation into your current role as president and CEO of the Massachusetts League of Community Health Centers. First, give our audience a little idea of what this organization is.
So important for your members to know that in the 1960s, we were desegregating lunch counters. We were trying to integrate schools, right? Even here in Boston, there was a battle going on with the Boston NAACP, trying to challenge the issues of equity in education that led to busing. with the Garrity decision here in Boston, Massachusetts. But those battles were being waged across the country. In addition, there's a battle that was taking place in healthcare. I tell people all the time, if you're angry and you want to march the street saying no justice, no peace, I can't breathe, over Eric Garner and Tamir Rice and Breonna Taylor and George Floyd and the long list of other names. If you understood how many Black and brown people unnecessarily died from health care related issues, diabetes, heart disease, cancer, at a disparate rate, that means a higher rate, unnecessarily, whether it's due to unequal treatment by providers, unequal access because they don't have insurance, so they don't have the same quality of care, or the circumstances we live in, all right, the social determinants of health. That was part of the struggle in the 60s too. And credit to a man named Jack Geiger, who was a physician at Tufts here in Boston, and Count Gibson, his colleague, and a whole group of Black clinicians across the country, Dr. John Hatch, Dr. Smith in Mississippi, all organized and said, let's start out of the civil rights movement. Let's build a movement around creating healthcare access in communities. And Tanya, what's critical is it wasn't just about healthcare. It was about empowering communities by making them 50+% of the board. So you didn't just have, a board that was made up of corporate execs. You'd have people like my mother sitting on the board, who's a patient of the health center, consumer board members, weighing in on the care and the quality of care and the access to care at those sites. So that movement gave birth to community health centers in 1965. The first health center was here in Boston at Columbia Point. Geiger Gibson Health Center. Columbia Point, for those who don't know, is a housing project in Boston. My sisters grew up in Columbia Point. And now we have thousands of community health centers across the country doing that critical work. The Mass League that I represent was started just a few years after the launch of health centers in 65. And this was the association. So we have 52 health centers in Massachusetts, serving over 1 million patients out of over 300 practice sites, 52 organizations with 300 practice sites, because they could have more than one. And they're providing dental, eye care, medical care, behavioral health, substance use services. And my organization represents all 52. So I get to represent these entities that I grew up in. I was a patient at Whittier Street Health Center in Boston and Roxbury. I was a patient at Rox Comp, which we no longer have. It went out of business some years ago. But that's where I got my food and my care and my summer programs. And now we have many of them across the country.
And I'll mention I was a patient at Dimmick Community Health Center, so I remember it well and received excellent care. Because I think that one of the ideas around community health centers is that they think of community health center as a pejorative, in that you're not getting as good of care. You're kind of getting like the trickle down or less than. And these are very experienced doctors and presidents and nurses and people who are running these organizations. So what do you say to that idea that, it is less than going to a traditional hospital or larger organization like, say, Harvard Vanguard or something like that?
Yeah, so one is that's fake news, that's true, that's the case. But there's some truth to it in this sense. So it's fake news in that you're going to get quality care. There's a lot of oversight that community health centers have, both federal, state, and local, that talk about and have to evaluate our quality of care, our access to care. We have very high standards. If you've seen one health center, you've seen one health center. Dimmick is different in Roxbury than Lowell in Lowell, Massachusetts, or Lawrence or Chicago. They have very unique populations. They speak different languages. Some of our health centers speak 20, 30 languages for the populations they serve. So they have high standards and they serve quality, provide quality care. But the reality is, if you feel like your health center doesn't have the right technology, if your health center doesn't have the right building, because quite frankly, some of our buildings up until President Obama passed the Affordable Care, the American Recovery and Reinvestment Act in 2008, or the Affordable Care Act a few years later, invested large sums of money for that local health center that was in a storefront in your neighborhood to have a massive building that had the infrastructure to provide that quality care you needed. So there is a little bit of truth to that, in that we were under-resourced. Folks, we had to advocate that we had the resources, but the doctor, like you had with Dr. Maisha Mentor-Jordan, top-notch doctors, top-notch nurses, top-notch technology folks, and medical assistants, PAs, physician assistants, all those trickle down to provider types. But we needed the resources, right? We needed the dollars. We needed to make sure that we had a workforce, a pipeline of Black and brown. One of the things that's critical to your question, Tanya, is this. The great thing about health centers is if you walk into a health center and you're in, say, Brockton, Massachusetts, chances are you're going to see a large number of Cape Verdean staff. You're going to see a large number of Haitian staff. You're going to see a large number of those white immigrants who work in the health center, because they reflect the community and they speak your language. They speak Cape Verdean Creole or Haitian Creole. And that's really the beauty of health centers, is that local health center should reflect the culture, the values, and the concerns of your community. And that is what we aim to do.
I think what we're dealing with now with this pandemic is the access to testing and vaccinations in communities of color. And we know, and this has been reported almost each month that since this pandemic has kind of taken over this country, that Black and brown people are dying at higher rates than other populations. Now, I know you served on Governor Charlie Baker's COVID-19 advisory group. What is the most challenging issue when it comes to COVID-19 in communities of color?
So it's an interesting question, Ty. I would probably start to say the most challenging thing for us as a society in this moment of responding to this pandemic is that we've had racism in medicine. And what it's created is the unaddressed issue of racism in medicine. Before the pandemic, before we ever heard of coronavirus, we were dying at a higher rate of almost every disease I can name. I'm sure you know, Tanya, our family members always told us the story, when white America catches a cold, Black America catches the flu.
Yep.
So I asked the question, what happens when white America catches COVID-19? We die, right? And that's the reality, and it's harsh, but it's true. We already knew this is I call it our national Katrina. We live in congested households. We have two more comorbidities, the diabetes, the heart disease, the cancer at higher rates. We live 5, 10, 15 years less for reasons that are preventable, for conditions that are treatable. We're in circumstances where we're food insecure, transportation insecure, like they were in New Orleans, housing insecure, one paycheck away from being homeless, and too many Black and brown families. And we can't stock up on water and supplies like other communities because of our economic situation. You and I know the story of Black wealth, the huge disparity in wealth for Black and brown communities. All of that is the perfect storm that in the middle of a pandemic will have us dying, suffering, losing our wealth, struggling at a higher rate. That's our reality. We should have known that before day one of this pandemic. And just like Katrina, we didn't pay attention. So here's where we are. The reality is we're 2 to 3 times more likely to die of COVID-19, 2 or 3 times more likely to be hospitalized of COVID-19, and 2 or 3 more times likely to be infected with COVID-19. That's a concern that we all should be aware of, because we have all those challenges I just talked about. And just for a little historical footnote, Tanya, to this conversation, so were we in 1918 with the Spanish flu. Mm-hmm. 1918, when we had the Spanish flu, where 675,000 Americans died during the course of that 2+ years of the pandemic, folks have not really paid attention to. We were more likely to be infected, hospitalized, and die in the spring of 1918 because of those same circumstances: congested households, poverty, not a good access to healthcare, insurance, lack of insurance. And it took a toll on us in the spring of 1918. So time warped back into 2021. We have to address that. The COVID-19 vaccine working group that I serve on, of the governors, is really just about prioritization. Phase 1 of that prioritization, as you know, Tanya, was really focused on our healthcare workers first, because in order for us to continue responding to these surges, We need to have the workforce that can be there when you come in, not you, meaning you, but when someone comes in and they need a ventilator or they need some treatment so they can survive this pandemic, we need to make sure that they have those resources and that they have the professional there to do that. So we started with them, the first responders, the home healthcare providers, and credit to Massachusetts. We also included those incarcerated. Because the unfortunate part is we know the revelation around the new Jim Crow, Michelle Alexander's book, we've been pipelined into prison at higher rates. Black and brown people make up, in some cases, 60+% of a prison population for nonviolent drug offenses. And that they're in these congregate facilities where they can contract the disease and be disparately impacted as well. So we prioritize them. Credit to Massachusetts, check one off the box around equity. And in addition to that, homeless shelters is included in our category. So, of course, as you see play out in the news, all kind of challenges with prioritizing, even in phase one, right? How do you get to the health equity within healthcare workers? How do you get to equity within congregate care facilities, nursing homes, and home care providers? We're still struggling with that, and we need to work that equity issue out. Quite frankly, it's still disturbing to me. The other piece of that, Tanya, to your question, is the hesitancy. In the summer, half the population said they wouldn't take the vaccine. And higher numbers for Black and brown people. By November, when we started to know that there was a vaccine available, those numbers moved. Still highly, communities of color, highly suspect of the vaccines, including Black women, by the way, in many surveys, were the most distrustful. And I always point that out when people ask me. I say, because sisters are the patient navigators in our household.
Yes.
If you want to have a medical procedure of a family member, our sisters are the ones who are like, no, I need to know what you're doing, right, how you doing it, will we survive? So they need the evidence. They need to know the science, and they need to have qualified people give them the information before we take it. But we're not taking it in the rates we should be. And the result of that is other people are getting access to it when we're not. So it's the equity issue and how it's being distributed, which elected officials and regulators have to work out. And then add on top of that, they were also hesitant to take it, which means that if we give up our place in line, someone else is taking our seat, and they're probably white. So we have to deal with that as well.
We're talking about the trust issue right now, because I think a lot of the trust issue also has to do with just trust in the science. Most of us remember what happened with the Tuskegee experiment. And so that kind of laid a foundation of really not trusting doctors, not trusting the science, not trusting vaccines, partly because of that, but just not having that same access and connection to medicine that our white counterparts have. So speak to that a little bit in terms of just the trust in the medicine and the science.
So, healthcare hasn't earned our trust. So, if you are a student of history, and I'll say this to folks sort of our age, if you're a student of history or history, then you know about Dr. Marion Sims, who experimented on Black women slaves. He's the father of gynecology, who in the late 1800s operated on, and without anesthesia, by the way, which we had at that time, operated on Anarcha. Lucy and Betsy were three of the Black women slaves he operated on, that you could experiment throughout slavery on Black people in a way you couldn't do with white people, right? There was already protections around experimenting on white patients, but they knew, so you couldn't experiment on a white person unless they were in dire health conditions, and then you had to do some intervention to save their life. But Black people, you could take a healthy Black person and do those things to them, and they were examples under J. Marion Sims. Then you move forward into the Black codes and Jim Crow in the early 20th century. We were screened off from quality education. We were denied access to healthcare. And then you get into Tuskegee syphilis experiment in the 1930s that went all the way through the 1970s, when we, Tanya, were considered the syphilis-soaked race. Bad blood. We had bad blood. And they operated on but they pulled some 600 Black men into a study where they did not treat their syphilis for those half of that population that was actually had syphilis. they did not even treat them. That was ethically wrong. Dr. Marion Sims was ethically wrong, and the many others that I can't name in the course of this conversation. Fast forward to Henrietta Lacks and the taking of her cells in order to have medical advancements, or fast forward to Institute of Medicine's report in 2002 that unequal treatment, that validated what Auntie and Uncle Nim was telling us about doctors don't treat us the same. They don't give us the same medications. They think we're drug addicts. They turn us away when we have cancer. We find out by the time we have stage 4. Institute of Medicine's report validated what all those Black activists had been saying for generations. And then there was another report that people don't talk about, To Err is Human, talking about the large numbers of medical errors in the medical field. We were getting the brunt of those too, that no one's talked about. So we have a reason to distrust. But I tell people all the time, we also trust our healthcare system all the time, Tanya. You go to the doctor right now for a broken foot, for some medical condition, you understand 5% of what they're going to do to you. So we now need to regain trust. They need to earn it, but we need to now have trust that the science is there for this vaccine, and know about people like Dr. Corbett, the young Black woman who was a part of the NIH team that found this vaccine, and the many other Black and brown scientists, clinicians who are in the evolution of where we are now.
How will the Massachusetts League of Community Healthcare Centers work with the state, with communities, to make sure that this kind of information is getting out to anyone who wants to be vaccinated and being able to have access to it? You know, we heard stories in the last couple of weeks that, Gillette Stadium's going to have a place, Fenway Park is going to have some place, and, that's not easily accessible to people. How will you help work with the state to make sure that vaccines are in the communities, accessible for people to go and get vaccinated if they choose to?
So it's so funny, Tanya. You asked me a question, and I started hearing a gospel song in my head, and all of my family members who can actually sing would beat me in the back of the head if I started singing "Go Tell It on the Mountain." However, I think that's where I would want to start to answer your question, which is we need everybody to tell the story. There's a lot of fake news on social media. There's a lot of people who come from other countries who have people telling them false information. There's a lot of people who just don't trust, and they believe the fake news. So we have to go tell it on the mountain and get the information yourself. If you go to the Department of Public Health's website right now and look around, there is a template for town hall meetings that you can share with people, and the answers. Does it change your DNA? No. Was it tested enough? Yes. With more testing being done as we speak. All those answers to the questions that we would naturally have and that we need to answer, particularly as I mentioned, for those sisters who are the patient navigators in our households. And those are on the website. So I need people to go to the Massachusetts Department of Public Health and look for that information. 2, health centers are in that mix. We're doing ad campaigns. We're sharing the information. I'm talking today to some of the foundations about a campaign around Get the Facts. I know, I think it's Cedric Maxwell has a campaign that he's thinking about launching, former Celtics player. There's a lot of people out here, and I think that goes back to that gospel song, Go Tell It on the Mountain. There's not one of your listeners that we don't need out here telling the story, right? Mm-hmm. Tell it at your church, your book club, your sorority, your fraternity. You be the change, you be the messenger on what this is and what it means. Even if it's not telling people to take it, but it's just giving them the facts. Is where we need to be. We know that the surveys say 80+% will take it at some point, including Black folks, which is actually good news. But the thing that the surveys tell us, and Museum of Science did a survey with the Mass League Community Health Centers and Mass Inc. that says this, is that they want to wait on somebody else to take it first, which I think is kind of funny, right? We want to know that you took it and you're okay. So we need to have people who've taken it tell their story, that they've taken it, what the side effects were, when they've taken the second shot, if it's Moderna or Pfizer's 2 shots, if it's Johnson & Johnson, which probably will be approved with emergency use authorization within a week or so, 1 shot. We need people to share their story and then tell why they took it. I took it, as an example, when I'm up in line. If somebody asks me, I'll say I took it for my family, right? Because I need to make sure I'm here for my kids. I took it because I need my mother to trust it, and she's 76 with 2+ comorbidities. I took it, and I'll go down the list, right, of why the reasons that I will trust the science in this moment. And I'll say I took it because we're dying. Quite frankly, we're dying. And the only way that we have a chance to save our lives right now is through this vaccine.
The Power Play typically ends with asking our guests kind of 3 rapid questions. So my first is, what would you like people to know about the importance of health centers in communities of color?
We are you. We reflect your communities, your cares, your needs, your values, your interests, and we share your desire to live a healthy, as long of a life as you can live. And we want to be in the mix with these social justice movements across your communities, right? We should be weighing in on those issues that are important, that are, as we now know, social determinants of health. And we want to be there for you as well.
What is your hope in your new role?
You know, I guess my hope in my new role is one, that I return the favor that was given to me by those health centers when I was a kid, that I be part of this health center civil rights movement that is to bring quality healthcare to communities and do it in an equitable way. And that maybe I can influence the larger healthcare system, both here and across the country, to make health equity a primary goal for everyone. And I think for every person who dies too soon, that is Black lives need to matter, as I think what comes to mind. If they matter, we'll save more lives.
And finally, in terms of COVID-19, in terms of the testing, in terms of the vaccination, just your last pitch to people who still are not understanding or even trusting the science.
So maybe most importantly is I need you to trust that there's a pandemic, right? We're approaching 450,000 deaths. 450,000 deaths in this country, with millions of people being infected and dying across the country, across the globe. This is not fake. This is real. And just in case you didn't know, we've been here before. As I mentioned, the Spanish flu, we'll be here again after COVID-19. And we need to be better prepared next time. But what we need you to do right now is to take this seriously. If you take it seriously, and you take the fact that right now you may be sitting in your home, eating dinner, talking to your kids, or maybe your kids are online. If you don't take this seriously, you could be losing a loved one in a week from now, or a month from now, or a year from now. We need to embrace the science. Do your homework. Just look it up, read it, and then figure out whether you're comfortable for you and your loved ones to take the vaccine, because we absolutely need to get to herd immunity at some point in 2021. And that threshold is like 80-something%. We won't get there if people are hesitant.
Michael Curry, thank you so much for being a guest today on the Power Play. We mentioned a couple of websites. Those will be on our website at thepowerplayshow.com. And you can learn more about the Massachusetts League of Community Health Centers by visiting massleague.org. And there you can also find out the health centers in your neighborhood. Thank you again so much for being our guest today.
Thank you, Tanya. Anytime you need me, let me know. Thank you.
All right. Remember, you can listen to past episodes of the Power Play wherever you subscribe to podcasts, including iTunes, iHeartRadio, and now Pandora Podcasts. You can also watch us on YouTube. Simply search Hull Bay Productions Media Channel and be sure to subscribe so you never miss an episode. And as always, we air on BroncoEyeRadio.com each Saturday at 5 p.m. So be sure to tune into the Power Play show each Thursday for a new episode, wherever you subscribe to podcasts, or on YouTube at Hull Bay Productions Media Channel, or simply visit thepowerplayshow.com. As always, until next time, I'm Tonya McGrath. Put on a mask, stay safe, and protect each other.